Hello and welcome to all of you from wherever you are in the world. I'm Elna Rudolph from South Africa. I'm the president of the Next WAS conference, and it is my absolute honor as a member of both organizations to welcome you to today's session. The International Society for Sexual Medicine and the World Association for Sexual Health is hosting this session jointly, and we are talking about sexual rights at the core of sexual health intervention. I would like to encourage you to say hi to us in the chat and tell us where you are from. I can already see we've got people from Mexico, from Helsinki, and all over the world. We are joined by colleagues from we've got more than 800 colleagues from around the world joining us today. If you have any questions for our panelists, I'd like to ask you to put it into the Q&A section and not into the chat, please. And we will be done with this session after 1 hour. All the panelists will be done, and then we will start with the discussion. So we invite you to stay on longer for the discussion, please. And now I would like to introduce you to the whole team of they are slow to switch on their camera. I can see we've got people from Namibia, from France, and now my internet connection is unstable. Of course, we will have a bit of a glitch there with the unstable internet connection, but I can see most of my colleagues on the screen there now. So you can see that we've got the president of the ISSM, Luiz Otavio Torres. Hello, Luiz. And we've got the president of WAS, Pedro Nobre. And we've got the president-elect of the ISSM, Ana Maria Giraldi. And the vice president of WAS, Esther Corona. The two of them will be moderating today's sessions. And then we've got our speakers, Arthur Burnett from the USA, and Marcia Rocha from Brazil, and Eusebio Rubio Areoles from Mexico. And I welcome all of you, and now I will hand over to Luiz to introduce Ana Maria to you. Thank you.
Good morning, good afternoon, good evening to everyone. My name is Luiz Otavio Torres. I'm the president of the ISSM from Belo Horizonte, Brazil. I'd just like to say that in this time of pandemic, we try to keep our goals of spreading sexual medicine around the world, so that we begin the webinar series. And it's really a pleasure having this webinar joint with WAS, the World Association for Sexual Health. I think that's a very, very good topic. The sexual rights at the core of the sexual health intervention. And so we have one of the moderators that I'd like to introduce is Dr. Ana Maria Giraldi. She's professor of psychiatry with a special interest in clinical sexology at Sexological Clinic and University of Copenhagen in Denmark. She's the president-elect of ISSM. She's still deputy editor of the Journal of Sexual Medicine, and she's the president of the past president of the International Society of the Study of the Women's Health issues. And so Ana Maria will be one of the moderators. And now I give the word to Pedro Nobre, the president of WAS.
Thank you very much, Luiz. Good morning, good afternoon, good evening, everyone from around the world. This is a fantastic event. Let me just say first a few words and congratulate ISSM for this joint meeting. For us, for the World Association for Sexual Health, we are very willing to increase our partnerships with other global organizations such as the International Society for Sexual Medicine, and I believe this is the first of many events, joint events, so I'm very happy with that. Let me just say that I come from Portugal, from Porto University, where I'm professor of psychology, but I am the current president of the World Association for Sexual Health. And for the ones who are not very familiar with WAS, I just want to say that WAS is one of the oldest global organizations in the field. We have more than 40 years now, and we have over 100 member organizations from all over the world, the 5 continents, representing thousands of professionals. And our main mission is exactly to promote sexual health and sexual rights across the globe and during the lifespan. So it's a very, let's say, ambitious mission. And I invite everyone who are interested in working through this mission to join us and go to our website and know more information about the WAS. I just want also to say that I'm very pleased to introduce Esther Corona, who was Vice President. Esther is based in Mexico City, and she is actually one of the founders of WAS and one of the images, let's say, historical figures of the World Association for Sexual Health. And so I'm very pleased to introduce to Esther, who is also my Vice President at WAS.
I have so.
Have no
You're
mic.
muted. You're muted, Ana Maria.
I'm trying to unmute myself. Now it's better. So I try again. So sorry for that. So I just want to say thank you to WASH for doing this together with ISSM. And I also want to say hello to all the friends and colleagues that are joining from all over the world. It's so exciting that we can share knowledge and meet in this forum and exchange ideas and discussion. So I just want to welcome our faculty. We have a very distinguished faculty with members from both WASH and ISSM, and some of the members are members of both WASH and ISSM. So we have Burnett from the US, Marcia Rocha from Brazil, and Eusebio Rubio Areolis from Mexico. So it's a pleasure to introduce to you a little bit in details Dr. Professor Burnett, who is Patrick Walsh Distinguished Professor of Urology at the Brady Urological Institute at the Department of Urology and at Johns Hopkins Medical Institution in Baltimore in the US. Bud is a treasurer of ISSM, and he has also served in many other professional and organizational capacities, including he's the past president of the Sexual Medicine Society of North America. He's a board member of Urology Care Foundation of the American Urological Association and a member of the American Association of Genitourinary Surgeons, among other distinguished positions he has served in. So Bud is going to talk about sexual health as human rights, protection by law, and I invite you, Bud, to come to the scene and give your presentation. Thank you.
Okay, there we go. Just had to unmute. All right, well, let's go to the next slide. Thank you, Ana Maria, for that kind introduction. So this entire webinar is born out of what's going on currently in our world, where there is concern about human rights. There's a great deal of social unrest that has arisen in the United States and elsewhere. And this talk then speaks to respecting humans and respecting human rights. Next slide. The objectives specifically are to acknowledge the evolution and the scope of sexuality and sexual health rights in the context of human rights, and then to understand the sources of human rights laws that relate to sexuality and sexual health. And I would also like to point out that we'd like to affirm that we'd like to continue with call to action with laws and policies that support sexuality and sexual health. Next slide. So what are sexual rights? Well, there's no formal political international consensus on the term, to the extent that there may be some differences in how that's defined, but it is grounded in human sexual rights. And the conceptual basis do derive from international treaties, national constitutions, laws, and there are a variety of organizations as listed on the slide that have contributed to the conceptual basis of human rights as it relates to sexual health. Next slide. The working definition, again, a busy slide here, but the definition here with some core points are that they are recognized within human rights treaties, that there is a framework of sexual rights that are protected by way of understanding protection against discrimination. And then further, concerning not just sexual health, but gender identity and expression, that this also is important and forms the basis of legitimate sexual relations. So I think it encompasses all of these areas with regard to defining the term. Next slide. Now, why is protecting sexual rights a necessary goal? Well, I think it can be simply stated, and I think the World Health Organization can take some credit with some of this, the importance for fulfilling and pleasurable sexual relationships, that it's a critical component of human development and general well-being. So just a basic aspect of humanity. And it is essential for social justice and public health. Next slide. Now, the origins of human rights international law, by way of considering here the context of this talk, does derive from history. And the horrors of the Second World War in the 1940s led to the establishment of deriving these laws in 1945. It was codified in 1948 with the Universal Declaration of Human Rights, and this acknowledged that human rights should be protected by the rule of law. Next slide. And there are purposes in this by way of human rights standards. First, to foster sexual health across and within various populations. And this follows a principle of non-discrimination, that it promotes comprehensive sexual information. So access to the information that's critical to this area of the discussion. And it assures the implementation of sexual health related policies, programs, and services. And this speaks to the principle of accountability. Okay, so I think these are the three fundamental pillars, if you will, of laws to be enforced. Next slide. Now, the principle of non-discrimination, I think, is key. And I won't read the slide here, but you can see there are a number of aspects to it that make it very clear that there should be no discrimination on the basis of a number of criteria, ranging from ethnicity, background, various religious creeds, purpose for enjoyment or exercise of sexual rights. All of this is to have no discrimination on any grounds. And it's not to be prohibitive based on any kind of non-exhaustive reporting here, but this is meant to be inclusive of all of these different aspects here that should be considered by the principle of non-discrimination. And this is actually grounded in the United Nations with a variety of sources that support the social and cultural rights of these elements. Next slide. Now, there has been legislation that's been put forward against discrimination, and so there are a number of legislative bodies that have put forward aspects of sexual health, and these are just some examples here. Grounds of sexual orientation and gender identity, grounds of gender identity, gender, sexual orientation, and gender linked to ethnicity and socioeconomic status. And so a couple of different assemblies and treaties that support legislation now against discrimination, and that is emerging now in various bodies. Next slide. And I also want to then make sure that I convey that this is an area that has been impacted by a variety of supportive treaties, regional courts, and monitoring sources. And then you can see that this is met here with all of these different varieties of authoritative bodies that have brought forward human rights laws. Next slide. Now, court rulings related to sexual health have covered these various topic areas. And I thought it was important as I read the literature on this that, yes, we can list a whole host of different areas that relate to sexual health. And you can see all of these here are ones that have had some court rulings that range from contraception, abortion, sexuality education, adolescents' access to sexual and reproductive health services, freedom from sexual violence and rape, privacy for same-sex behavior, and non-discrimination of transgender and lesbian or gay persons. So all of these areas are topics that have had court rulings related to sexual health. Next slide. Now, it's important to recognize that this area of law reform remains ongoing, and there remain challenges. And despite treaties and monitoring sources, these issues that we bring forward tend to be recommendations and interpretive statements, and they still have to be enacted upon by nations to formulate and enact their laws, either to ensure or failure to do this in terms of human rights obligations. And it's variable around the world. So that's why we have to continue to advance our efforts here, because national practices, customs that can vary around the world may claim exemption from this international review. So it is important for us as organizations to continue to advance human rights and sexual rights as an evolving component of this regime. Next slide. So in closing, I would like to give you a quote from Martin Luther King Jr. "Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly." Next slide. So take-home messages: sexual health is attainable, and this is achieved by the protection of human rights, and we must continue all efforts to advance human rights as a fundamental cause. Thank you.
Thank you so much, Bud. And I'll give over the microphone to Esther. That's going to introduce the next speaker.
Good morning, good evening. We are very, very pleased to have you all on board. And this is a fantastic occasion because of this joint effort that we're doing together. And a special welcome to all our membership, both ISSM and WAS. And as I was saying in the chat, if you're not a member, please join us. I think we together can do a lot of good work. Right now, I'm going to introduce to you Marcia Rocha. Bud has just taken us through a whole range, an overview of what are human rights and what are sexual rights. But sexual rights have to be lived if they're going to be really true and to be realized. So now we're going to hear from Marcia Rocha, who's a Brazilian, a lawyer, a trans businesswoman who owns 4 businesses, 4 great organizations. But besides that, she's a certified sex educator, and she's also a professor. And last but not least, she's a member of the our Sexual Rights Committee at WAS. So Marcia, we are just wanting to hear we're just waiting to hear how all this theory translates into real life experience. Over to you, Marcia.
Okay. Hi, thank you. I'm a lawyer from Brazil. She introduced me very well. So I'm going to present you some slides to tell my story and how it works, how prejudice works on the society, and how it's harm for everybody. The slides, please. Okay, on the first days of school, when I was about 4 years old, I tried to spend time with the girls just because I identified myself with that universe. I have never said I'm a girl or my body is wrong. I just felt femininity inside of me. There were boys and girls, and I wanted to be with the girls all the time. After some time, I suffered bullying from my school friends, and I was instructed by the teacher to stay with the boys. It was a kind of violence for me, so I had no choice but begin to have 2 different expressions, a masculine one for the world and another one for myself. Next. During my childhood, always in secret, I already dressed with my sister's and mother's clothes, wearing makeup and high heel shoes. I needed to express that femininity inside of me, even if only to myself. At 14, my voice began to change and my body didn't develop the curves that I saw appearing on other girls. So I began to take female hormones on my own. In a few months, my father noticed my breasts growing up, took me to a doctor, and I was forced to tell them how I felt. They both sat down in front of me and convinced me to stop taking those pills and keeping my gender identity as a secret for my whole life. Next. So I finished the high school, got a law degree at a very important university, had my first job, and continued on with my life, always living a double life. I did this until I was 39 years old when I decided to get out of the closet, take hormones, and live as I have always wanted to. I am the first transgender lawyer to make an oral presentation at the Court of Appeals in São Paulo in one of the most important cases of discrimination in the history of Brazil. And I was the first person to have two different names on a federal document. I have 4 business companies. I speak 3 languages. I live in a $2 million house. I have a yacht. Next. Next slide, please. Next. But if I had gone against my father at that time when I was 14 and had continued the harmonization, all those things could never have happened to me. I could never have finished the high school or the university. I could never have had my first job, have lived in other countries, had my first company, etc., because of the society's prejudice. I think that my father was a real hero because he has never said to me, don't be, but he said, don't tell. Next. With this finding in mind, me and 4 other transgender friends decided to do something about it. So we created the Transempregos project, which helps transgender people to find jobs, even if they are already transitioned into the opposite gender or not. Next. With this finding, we have a database with more than 5,000 curriculums, and the following are some of our partner companies which already have transgender people working for them or they're trying to have. Next. Next. Next, please. Minorities usually have trouble getting a good education, a job, and all sorts of opportunities. We control each other in society all the time, oppressing whatever is different, keeping a model of what the perfect human being to be followed is. This model just doesn't exist. Next. When a society prevents someone of studying, working, having a family, being happy, just because of prejudice, it's doing something against itself. Next. Since 2014, more than 2,000 transgenders were hired, and only last month we had more than 100 job opportunities offered, with 27 persons contracted, even during the COVID-19. Last Tuesday, the day before yesterday, we launched a very big teaching program in partnership with google.org to help transgender people to improve their skills and knowledges during the pandemic. We all need to continue fighting for the equality despite policies, beliefs, or viral epidemics. Next. We are all human with our subjective differences and characteristics, including our sexuality. We must always consider the sexual rights as human rights, respecting subjective differences, including sexual issues and diverse gender identities. Diverse gender identities, because they're multiple, in order to ensure full health for all. After all, we all have the right to exist. Thank you.
Thank you so much, Marcia, for taking us through your personal history and also putting it into the perspective of what it does to a society and how it relates to human and sexual rights. So thank you very much for giving us this talk. So it's a pleasure to introduce the next speaker. Okay. So the next speaker is Dr. Otavio Rubio Areoles. He's a medical doctor and a PhD from Mexico. Otavio is the founder and director of the Mexican Association for Sexual Health. He is the past president of the Federación Mexicana de Educación Sexual y Sexología. He's the past president of the WAS, and he's also the past president of the Latin American Society for Sexual Medicines, which is a regional society of the ISSM. So it's a great pleasure to introduce Bud to you, and I'll just leave the screen to you, Bud. No, not Bud, I'm sorry, Otavio, and give you the possibility to present your talk, which puts focus on how we as clinicians also ensure that our patients and the way we work will introduce sexual rights and human rights. So Otavio, welcome.
Thank you very much, Ana Maria. The challenge of this talk is rather simple. I will try to connect what Bob said about the law to what Marcia said about his personal history and personal life. And I should say it's focused on clinicians, but it's also relevant to educators and activists and many other actors in the field of sexuality. And I hope I can share my personal experience dealing, promoting, and clarifying sexual rights. So my talk is the same topic of the symposium. I just realized that after preparing it. And well, I want to start with a very simple concept. As clinicians, and this is an experience that I often have being a teacher in medical school, when we talk about rights, it seems that we are moving to a different profession. And the reason for feeling that is very clear, because clinical practice of everybody who is clinician, or educational practice for that matter, is based on a series of things, and it's defined in such a way which seems not to be related to rights. As a way to define clinical practice, a series of recommendations based on different levels of evidence, now that we are in the evidence-based practice, that provide guidelines for improving possibilities of success in clinical practice, educational practice, when a person requires help to find a solution to a problem or to educational goal, I should add. Instead, human rights, and this is the definition from WHO, from the United Nations, are rights inherent to all human beings, regardless of race, sex, ethnicity, language, religion, and other status. Human rights include the rights to life, liberty, freedom, for slavery, torture, freedom from opinion of expression, the right to work, education, and many more. Everyone is entitled to these rights without discrimination. Okay, that is rather simple to understand, but it looks not so simple to put it into practice. And I believe one of the reasons it is difficult to unite these two congresses, that to these concepts, is that these are based on different levels. Clinical practice, we base a practice on expert opinion, less powerful evidence, but we base sometimes on cohort and clinical studies, on randomized clinical trials, and the best evidence provided by meta-analysis and systemic reviews. On the contrary, or not the contrary, but in a different venue, human rights are based on what? National court decisions, such as the ones exemplified, higher level regional human rights organizations and court decisions, even a higher level regional human rights treaties, which are powerful under the laws who recognize the international treaties, the international human rights treaties, and basically the human declaration, the Universal Declaration of Human Rights. So what sexual rights had to do with it? Well, this is the picture of the Human Rights Declaration form, the famous picture. So I did a text search on the declaration. So I looked at numbers of times the word sexuality was mentioned, 0 times. The number of times the word sexual was mentioned, 0 times. The word sex, 1 time. Okay, but in the context of Article 2, which is really one of the conditions without distinction of the kind of sex, really in the sense of biological sex, sexual differences, or not even gender. So, as one of other very notable activists, Black woman and lesbian activist, Andrew Lord, said, silence and invisibility to hand in hand with powerlessness, which relates to the 2 previous talks very clearly. So, the problem is that when the concept of sexual rights appeared some years ago, in the minds of many people, and this is very interesting, sexual rights really meant gay rights or gay marriage or abortion. And that created a problem because those are things that are still contested, unfortunately, most of the time because of ignorance, because of conceptualization, sometimes because of ideologies, sometimes because of religion. But the problem of linking these 2 concepts, which are, I mean, of course, gay rights are part of sexual rights. Of course, gay marriage is part of sexual rights. Reproductive rights are, of course, part of sexual rights. But the problem is equalizing. An example, this is highly political, but the US forced to diminish the language related to sexual health, which in some of the administration linked to abortion, aligned with broad sweeping efforts by the administration to thwart words and actions related to sexual and reproductive health and sexual and gender rights. So this is a problem of conceptualization. It is really lacking the idea of what exactly sexual rights means. A number of organizations, of which is organizing, used to be named the World Association for Sexology. Back in 1997, a group of people organizing the World Congress in Valencia, when sexual rights and sexual reproductive rights were starting to be talked about, decided to try to systematize it and produced a very short, I remember the goal was to produce a 1-page declaration. It is pictured there. Of course, we're not getting to the detail. And then the IPPF, the International Federation of Family Planning Federation, also produced one. Our surprise, in discussions we had with the Pan American Health Organizations and many lawyers, because we were clinicians attempting to define sexual rights, lawyers came and say, oh, no, but that list that you produced there is not really based on what I mentioned. Not mentioned on court decisions, not mentioned on international treaties, not mentioned on anything. My goodness. Oh, so perhaps they have a point. Marcia, who is a lawyer, perhaps has some more experience of the need to connect both things, because if you don't connect it, they seem to be non-existent. So here we go, a team at WAS produced a second declaration, which is the same declaration, but connected to the law, to the international law, to the Universal Declaration of Sexual Rights, and explicitly expressed the foundation of it in human rights. This is explained in a rather long document. From 1 page, we move to a 96-page document, which is published there. And it is explained and connected with every single sexual right. Is connected to already recognized, that's why WHO says already recognized in international treaties and the Universal Declaration of Sexual Rights. So this discrepancy of sexual rights between sexual rights and human rights that apparently is still going on in the world, apparently it's clearly solved here. And as Bob was saying, now it's the law. Now the problem is that the law don't always is fulfilled. So sexual rights are grounded in universal human rights, as it was already mentioned, and is based on human standards and principles and scientific knowledge and related to human sexuality. Now let me go to human sexuality, because human sexuality and sexual health in particular was defined in 2006 by WHO with a long definition that I will not get into it. But the last part of the definition I want to point out is the sexual rights of all persons must be respected, protected, and fulfilled for sexual health to be attained and maintained. This link from health to sexual rights was clearly explicitly demonstrated. Interestingly, that little phrase has been erased in some countries' adaptations of this working definition of WHO. But the best example of the link of these two concepts is perhaps what happened with the international the classification of disease in the version 11. This is an old paper, 2015, well, some years ago. But it is very interesting because it is the group, this is the group who was proposing changes on the IC11 on sexuality-related issues. And the title of the paper mentions explicitly, it is based on scientific evidence, best clinical practice, and human rights considerations. So this is the IC11 that was approved, still in the process of being integrated officially to many countries. But this is what happened with this mixing of science, best practice, and human rights considerations. The first change that I want to point out is that before we had sexual problems, and now we're moving to clinical practice based on two areas of health: mental health and disease of the genitourinary system, the urology and gynecology fields. But now we have a special chapter devoted specifically to sexual health, in a chapter named conditions, not even disorders, conditions related to sexual health, which encompasses sexual dysfunctions, sexual pain disorders, anatomical, etiological considerations of these two, and gender incongruence. I will not get into details of this, but this is very important. This is what is considered the conditions related to sexual health. Paraphilic disorders, they were kept on the mental health because of a number of considerations, the kind of intervention that is needed. But I want to point out that the paraphilic disorders, as they are called now, were reconsidered on the basis of sexual rights. Because note the absence of fetishism, note the absence of transvestism, and note the absence of consensual sadomasochism. Why they were taken out of these considerations? Because the fetishistic person, if he or she does not harm to anybody, really has no problem with society. So it is the right of that person to enjoy his sexuality or her sexuality in the way without harming everyone. So this is a clear consequence of this mixing of the concepts. So just to finish, what are the take-home messages? Clinical practice and sexual rights have different ways of validation and refinement, of course. Best clinical practice should be guided by human rights considerations. When the clinical practice includes sexuality, awareness of human sexual rights is paramount. Inclusion, non-discrimination, the right to health, including sexual health that encompasses access to pleasurable sexual experience, are consequences of a clinical practice guided by sexual rights. Thank you very much.
Thank you very, very much, Eusebio. Thank you very much to all the speakers. We now have the question and answer session, and we have some questions coming in. So can you please put in the questions in the Q&A section? Then Esther and I will look at the questions, and we will ask questions that might be for the whole panel. It might be for one of the specific speakers. So please put in your questions, comments, whatever you would like. You might have experiences about sexual health, human rights, sexual rights from your own country, from your own practice. So please join us with the Q&As. So Esther and I will moderate this session, and I don't know if you have a question ready, Esther, maybe for one of the speakers?
Yes, I do. Yes, I do. In the chat, I have noticed several messages from our participants stating or discussing, discussing what several breaches in human rights in different countries at this stage. So there's a very important question, which is specifically for Eusebio Rubio. What a clinician can do if he or she lives in a country that doesn't recognize sexual rights. So Eusebio.
That's for me? Oh, sorry, I didn't get
that's
it.
For you.
So that's for
what?
Me. Well, that is part of the beauty of recognizing the link between sexual rights in declarations such as WAS or IPPF or other declarations that exist around. Even some governments, like the Mexican government, has produced statements on sexual rights. But if there is no legal support, surely there is legal support for human rights. So the way to go in case of a conflict of lack of recognition is to find in the human rights documents, in the human rights that protect people from not being discriminated, from access to health, to access to education, the foundations to defend your sexual rights. Really, the term is useful because it creates visibility, but it is not indispensable to fight for its defense.
Okay. Thank you. So how do we have another question here that says, and I think you touched a little bit upon it, Eusebio, but maybe also Bud and Marcia can comment on it. So how can we use our societies? We have ISSM, we have WAS in like advancing sexual rights and sexual health better than we do now. I mean, Eusebio, you describe how we make the statements, we say we need to do this. So how can we, what else do we need to do as societies? Maybe we can start with you, Marcia. What do you have any ideas about how can we do it better, or can we do it better? How can we work as societies?
We did a lot of things in Brazil, you know, about LGBT rights, especially. We need to fight. We need to fight the prejudice. We need to go to the court and try to, you know, fix what's unfair, and try to, you know, it's very difficult to, you know, to get laws because the Congress are usually very conservative, but through the judiciary we can do a lot. We did a lot in Brazil. We have the right for everything now. We can give blood, we can adopt, we can get married, we can change the names. Transgender can change names just going to the government and ask for that. So without any, you know, doctor or anything. So it's everything we got from the last 5 or 6 years. So because we are fighting a lot. So I think we change the what we do with the Transempregos project is to help the companies to understand that transgender can work and can be good, you know, workers and very competent. And it changed the society also, because when you are working with a transgender person, which is very good working on what they do, so what she or he does, so it changed the mind of everybody around this person. You understand? So what we need to do is just begin and don't not to be afraid of being suffer violence or something, like not really violence, maybe verbal violence, but we have to have the courage to go on, to push further always. That's what I think we need to do. And always when you hear someone speaking something that you don't agree, you go there and say it, because it's another way to change minds. Because in a group of 10 people, sometimes one is speaking something very bad about sexuality or against women's rights and things like that, but the other 9 persons maybe don't agree. So when you go there and say, I don't agree with you, I think this, and the other persons will you think about that better, you know. That's it, I think.
So Marcia, can I add a little bit question to that? Because I have the feeling that you're a very strong person. You have done a lot, like using yourself as a person. So if you could say, how can people all over the world use our societies to support their work for sexual rights and sexual health? So can we as organization, as WAS and ISSM, how can we be used? Is there something we can do better to support the work? Or is it always relying a little bit on a very strong local person that will take up the fight?
I think that WAS is doing already.
Yeah, I know that. Yeah.
So I think that's when WAS make the statements and the sexual rights documents and things like that, pleasure documents. So I think they are they have the support. They can be a support for everybody who wants to fight. You know, to say there is a document, there is something to be used by these people. So I think it's we are doing that already.
Yeah, I know that. Yeah.
And Maria, if I could weigh in on this,
Yeah.
I guess you asked all the panelists to give a thought to this, and certainly I want to congratulate the other panelists. I want to thank both WAS and ISSM for doing this. I think what we're doing here right now is a good example of steps that can be taken, creating awareness, advancing education in the area surrounding this, and then around the world, work as societies with global reach to hear what our colleagues and members have to say and see whether we can fight battles. I was very pleased with Eusebio's presentation, where he and his colleagues put together a document on this, and I think we need to continue to fight. Marcia did a great job too. I was very appreciative of that, to hear that yes, individuals can fight, but as societies, can we continue to do all that we can to produce documents, guidelines, try to understand what are the laws in different countries. If members come forward, try to work within our organizations to figure out, maybe in a very constructive way, how we can address the injustices that are going on. And I'm sure that this does involve some of us beyond our levels. Lawyers have to be involved and things of that sort. You know, poor surgeons like me, I mean, we know what we know, but we don't know everything. And then getting, you know, kind of a multidisciplinary effort is important. You know, I'm surprised even here in the United States, you know, we had civil rights legislation that was passed in the 1960s, and we are still fighting battles with regard to what the meaning of sex is. Eusebio nicely talked about that, the ambiguities surrounding even that term, and how others have various concepts of what that means. Maybe originally it was just a matter of a man and a woman, but there are great ambiguities surrounding all of this, and the whole aspect of gender identity and respecting that, with legislation that's just getting passed even in the United States now, with regard to employment laws and things of that sort, that has to recognize all of this. And so I think these battles need to continue. I think we need to continue to help define the argument so that people understand more what is meant by all of this. And sexual rights is not just a simple thing, but it really has a lot of context to it. And I think that I've been pleased to receive some education myself through the webinar here to think about how we need to think about this in broad context. But as societies, we need to help define this well and bring this message forward. And then hopefully we can also work towards advocacy, policy, and other kinds of efforts along the way.
Ana Maria, I would like to say something.
You're welcome.
And I hope you stop me, because I have so many things to say that can be too long. But because
we have a lot of questions.
So let me just summarize. I believe the action should be taken at several levels. So Marcia's example of a personal involvement is one way. Locally, organizations, individuals can have a big impact. But the question was, what's these big global organizations can do? And I am convinced that most of the opposition to these progressive ideas, because those are progressive ideas, inclusion, non-discrimination, this kind of thing, really are based on ignorance. At least that has been my personal experience when we had the discussion of gay marriage with the Supreme Court in Mexico. We actually went as individuals and as representatives of organizations to show the minister the research that has been already been produced. Evidence convinces most of the people. So the traditional, the conservatives, as they are called, that don't want to change their minds because they are afraid of something or have a second agenda, because they are not convincible and it will be a battle. But for most people, knowledge illuminates. So the goal, the goal of these big organizations, ISSM in particular, is to gather evidence and put it together. So legislators, judges, ministers, executives around the world have access, easy access, and they don't have to do a complex search improvement and everywhere to find where the evidence is. We can do that job for them, put the evidence together, and convince a large number of people. The stubborn people who really don't want to believe even in viruses, not to mention any particular example, are non-convincible. But most people with reasonable evidence modify their minds, modify their behaviors, modifying the laws, and that's the goal, and that's the way I believe this organization should go. Thank you.
Thank you.
I also have some very interesting questions and very relevant to the current situation. How do we bridge the divide between human rights and sexual rights in the face of the pandemic and restrictions imposed on sexual expression because of social distancing in relationships where partners do not cohabit unless restrictions are not observed? I think this is something very important at this particular time, and maybe one of all or our panelists can have give us some thoughts on this issue.
Well, I have many thoughts. I have shared some research we've done recently on that, and the fact is that social distancing proposes problems to expression of sexuality. That is a fact, and we should recognize it. Rights, this is a very important thing. I think this is a critical idea. Rights are not to be fulfilled at any cost, because sometimes fulfilling your right to eat, and the society is not working, and then you steal to eat, well, there's a problem there. You have to respect the rights of others. And the pandemic is putting us in a situation where if we don't follow these recommendations, we will hurt people. So we have two rights here in competition, and there needs to be a balance, a recognition. Fortunately, we have this marvelous technology that allows to be globally speaking with a large number of people without touching, without even actually physically seeing or being close. So this is perhaps an adventurous recommendation. but research has shown that even in extended families, virtual sexual interaction has increased due to the pandemic. So that's a recommendation. That's a way to express sexuality safely and without risking anyone. Just take care the people who you interact is trustable and not violence there. But I believe the fact is that we have a competition of, we have to protect the rights of others to not to be sick. As simple as that. And
I would like to say something. Okay. I think there is a little confusion between to have the right to do something and to be obligated to do something. So I want the right to be who I am, but it's not an obligation for everybody, you know? So you have sexual rights are very important to have, but it's not an obligation for everybody, you know? So we fight for the right to gays to adopt children, for example. But it's not an obligation for everybody, all gays to do that, or lesbian or transgenders. So, it doesn't causes a problem for the society, you know, because it is the right to do, but you're not obligated to. You have the right to you know, practice something, but you don't need to if you don't want, or if that's not a good idea at this moment with the pandemic. So that's it, I think.
Let me offer a thought here. Thank you. The insights I gained from each one of us speaking here, and I know we're dealing with very troubling times here with the viral pandemic, and this perhaps is where we have even a greater role, Esther, I think, Esther, in stepping up to bring education, bring support, bring what we know as therapists and counselors. You know, sexual health remains very important, no doubt, but we have to recognize the reality of this virus that has some serious health consequences and even deaths related to it. I know it's very challenging for the human interactions out there. Sexuality does involve intimacy many times. It does involve interactions, but there may be other forms of human contact that we certainly should promote in the spirit of good health guidance. The reality is we're dealing with a very serious pandemic. As a surgeon and a physician myself, I can tell you I've seen some serious challenges here in my hospital with patients, and we need to do our very best to support our colleagues who are making recommendations for the best health of individuals out there. But we need to also have a role here, and stepping up to provide some counseling and support remains very important. So I applaud the effort of all of us who are doing great jobs, particularly in the face of this challenging situation we're in.
Thank you, Bob. I think that another question that came in maybe goes a little bit back to what you also talked about, Otavio. The question is, how can we impact positively on sexual health and sexual rights, despite the fundamentalisms that are slowly gaining ground in political arenas in many countries, especially lately in Latin American countries? I don't know if it's only in Latin American countries. I think it's happening in countries too in Europe and all over the world. So I think you said, Eusebio, that knowledge will illuminate, but on the other hand, as you also hinted a little bit on, we have a lot of people where knowledge does not illuminate, and we have a tendency to more fundamentalism in many parts of the world. So the question is basically, how can we impact positively on the sexual health and rights with that tendency too?
But there are few preaching people who lack knowledge. And those people who lack knowledge are easily convinced by the arguments of this. And it is clearly happening in Latin America, clearly happening in many countries in Europe. I have very little experience, direct experience in the East of what's happening there. But I can tell you, the ideas that they are promoting are based on on unsubstantiated facts, unsubstantiated ideas. For instance, if they are creating fears that children in school will become transsexuals or homosexuals because they learn about homosexuality or transsexualism, that is simply a falsehood. Now, if people don't know this fact, and they hear this really intense attack to sexuality education, for instance, they will believe it. So that's a role of those who are close to knowledge, close to creating knowledge, close to creating science and presenting it. So we can, that's exactly what I wanted to say. The discourse of the conservatism, the fanatical, the ultra-right, or whatever you want to say, to name it, is directed to people who lack the sufficient knowledge and who are at risk. And it's based, this is another thing, it's based on a century and a half ago science. So that's a problem. We need to tell people. We know now that transsexuals, transgender individuals, is not something that somebody told them to do and then they decide to change their gender. That is not happening. We have lots of evidence, but when you say that, just last week, there is an attempt to recognize transgender infancy, transgender childhood here in Mexico. But there is a lot of opposition because where is the evidence? The legislators ask. Well, that's our task, to pack, not even produce, to pack the already existing evidence for the legislators, who are the responsible to take the decisions. And for the general public, I think it's very important to produce understandable science, communicating the knowledge that we have produced to clear the fears of people. Talking sex to youngsters does not create harm. On the contrary, it produces protection from harm. It produces benefits, but this has to be known in order to advance in the world. There is a little group, and I should say, because yes, the fanatical, the conservatives, the ones who are really convinced, they are very few. That has been measured already in the past. They are not so many, but they preach into a world where the ignorance is very, very high level. So that's a role. That's a role as scientists. That's a role as organizations that have an activist role, that have a scientific role, that have a responsibility to say what we have learned. And to say it with the scientific skepticism. This is what we know now. And this is a building knowledge every time. And this idea needs to be in people's mind. And in many areas of the world, that is why legislation is moving towards acceptance of sexual rights, because evidence is there. This needs to be a little more systematic and aware that we are dealing with powerful organizations, economically powerful organizations, not very big in terms of numbers, but very big in terms of power. So that's a way to go about it.
Thank you. And there's a comment from a person in the US says that in the US they have a lot of people that are resistant to knowledge and evidence. So yeah. That's just a comment to the panel. Do we have other comments from the panelists? From
Sure. I mean, I think that is despite the ignorance out there, despite those who are resistant to wanting to hear science, we still have to keep fighting in that direction. Eusebia is right that we have to continue to try and not give up despite all of that. And I realize these are just enormous challenges out there, but it is the right thing to do because if we don't, we're going to see kind of, I hate to say, what we see in the United States here. We don't want to follow scientific principles, and we're seeing people dying from the COVID situation. So I think that the reality is yes, we have to do that. I do recognize that in many places around the world, there are customs or traditions, there are religious faiths and various norms that create great challenges for the sake of women's health, for the sake of gender identity, for the sake of a whole host of things that we think are important to our societies. But I think we have to continue to try and define the subject matter, gather the important information, gather the evidence, and we've got to keep fighting these battles, and that's the right thing to do.
I think that we have so many very, very important questions that it will be impossible for us to answer all of them. But these point out in some of the important directions that we have to follow for new seminars and new meetings, and this dissemination of information, and dissemination of knowledge is extremely important. But at the same time, we need to work on advocacy. Advocacy towards politicians, advocacy towards grassroots groups. And there are some issues which have come up several times, both in the chat and the Q&A, that I think that would be very, we would really think it's very important to hear our panelists' reflections on this. And one of them is sexual pleasure. It says here, we talk now about the triangle of sexual health, sexual rights, and sexual pleasure. Can we see sexual pleasure as sexual rights? And at the same time, another participant says some sexual rights are challenging to fight for in the arena of policy. For instance, sexual pleasure, particularly of marginalized people, women, people of color, trans, older people. Can you give us some thoughts or experiences of how we can work on these less tangible sexual rights?
Well, I don't know if I can take the word again, but the idea that sexual rights exist imply sexual rights exist for all. That's a very simple thing. And always there are groups that are excluded from considerations, and that this is an historical pattern that sometimes one gets really disappointed, but it seems will never end. But it will. The advances that we have already have. But yes, there is the older people, not to mention females as a group. No? Older people, people belonging to ethnic groups which are not part of the majority. Those are usually discriminated against, not only in sexual rights, but in a number of other levels of human rights. So it's an effort to build a nicer and better and more healthy, to use the word, well, keep fighting and keeping recognizing that all persons are persons, even though that seems to be obvious. Sometimes it looks like it is not so obvious.
My thoughts about it, it resembles much of what you just said. Sexual pleasure, I guess, is the key term here. And I think this just, again, reflects humanity, reflects who we are as human beings. Sexual pleasure means that we understand what enjoyment is, that we have a way of processing in our experiences, ways in which we derive meaning from life. And we derive experiences from interaction with our loved ones. And then finding fulfillment in life. So to me, sexual pleasure does not necessarily just mean some sort of recreational act of an animal in and of itself. I mean, it really refers to who we are as human beings. And I think that is the broader context of that word that I hope can be conveyed, that sexual rights in the form of being able to maximize our humanness is really what I think is the way to put that into a conceptual framework in my mind, at least.
Let me share an internal discussion we had in WAS when we were discussing the declaration, the reformulation of the declaration. Sexual pleasure was one of the sexual rights. And the discussion was terrible because we couldn't, the lawyers who are experts on international law, couldn't find a document that recognizes sexual pleasure by itself. It is only recognized within the framework of health. And I think that is the way to go in the future, to recognize, as you both are saying, sexual pleasure as part of humanity. And if you don't recognize sexual pleasure as a right, we are really far behind our nature, or the things that we are. But the opposition to that is incredible, because we still are coming from the westernized vision of pleasure as danger. This doesn't happen, I believe, not totally expert on that, doesn't happen that much in the East. But here in the West, sexual pleasure is close to sin. And that creates a problem with the cognitive interpretation of pleasure that needs to be worked out. That is why sexual pleasure has become the center of work of WAS. And we had the last year in Mexico City, the Congress of the World Association of Sexuality. The declaration was the declaration of pleasure, the centrality of pleasure in health. This is very important, but this is still a declaration. And we have some evidence. There is not a lot of evidence, but there is a lot of fear of pleasure because people feel, if you feel nice, something is wrong. This is a cultural idea that we need to gradually modify. And just a word on customs. Yes, there are customs which are present in some communities, but they are harmful customs. They harm people, they create suffering, they create harm. And that needs to be exposed for communities to modify those customs. For instance, there was one question over there, I'm just intruding in another role, talking about the conflict between conjugal rights and sexual rights. Well, that needs to be solved because you cannot force anyone to do something that he or she doesn't want. Needs to be solved.
Thank you very much, Otavio. As a matter of fact, the recent state of the world population has focused on harmful practices, particularly for girls and women. And I think this is a very relevant issue. But Marsha, I think that maybe you can give us some insights into this area of pleasure and what has it meant for working with so-called sexual minorities?
Well, I think that, as you know, pleasure is something very important and subjective. You know, the way to reach pleasure, sexual pleasure, is not the same for everybody. And I am a transgender woman married to a woman. So I like to say that I am a lesbian transvestite. So just to be very clear for everybody, you know. So I like to, I think it's a way to, you know, I am who I am. I'm not pretending or trying to do something, you know, I'm just trying to live my life just how I want to be and to have pleasure. So all the societies have very very strong ideas of what is right and wrong about sexuality. And as you said, Eusebio, it's not for everybody. It's not the same for everybody. So to have the right to look after what you want, who you really are, and what is pleasurable for you, and not to be sad, not to be harmed, not to you know, it's something that's a human right. So everything is linked. Everything is the same. If you have the right to be equal, you need to have the right to get married, not to somebody that they tell you that's right to marry. So I need to have the option to choose what's better for me in all the matters. So I think it's something, and in Brazil we have a lot of transgender people that were trying to be who they are and to have a pleasurable life, but it was forbidden. It was prohibited before. So what we are doing is try to show all these people and show how they want to be, and that's no problem. There is no problem for the society. It's good for the society to have all these persons happy and producing and working and doing their best for the whole society. So it's something very obvious, but as Eusebio said, there are so many people who don't want to understand that. They don't want to see. They don't want to look over it. You know, don't want to know. So what we need to do is to make them to see and to understand that.
Thank you so much. I think we learned so much from this webinar, and I think there's so much good discussion and inputs. And we will have the one that don't get a response to their question here online. We will send the question to the panelists, and you will hopefully have a written response to your question if we don't have the time, because we are about running out of time. But I have a question that is for you, Bud. It says, what is the implication for sexual rights / sexual health care access and expansion of clinical care as a result of the social / racial justice in the, for example, the Black Lives Matter movement in the US? What do you perceive will be the impact on global influences that the US often has? So this is more like, what is the whole society, the whole role of what's happening in the US? You started with saying this is a little bit the start point you had in your talk. So how is the impact on the rest of the world?
Yes, well, thank you for that question. And I guess the implication is the word and is the buzzword there. And I hesitate to say that the U.S. is much of a leader these days with a lot of things that would seem to be what many of us with common sense would disagree with. I think that, yes, there's been at least the origin of this Black Lives Matters movement in the United States, but frankly, I recognize that there have been injustices around the world with all of this, and perhaps it just seems that the United States gets a lot of attention on, for good or bad, surrounding this movement. As far as whether what's going to transpire from it and what actions are going to be taken that may have impact around the world. And so that's what I guess the question is, what are the implications of this, and how are we going to address it, and what will matter by it? I think it's something that we will have to see. I have to tell you that from my observations in the United States, there have been a lot of symbolic things that have been done, monuments that have been torn down, with various murals that have gone up, paintings in the street, various protests, discussions about renaming various kinds of institutions and so forth. All of these sorts of things, in my mind, I hate to say it, but I'll be blunt, I just think these things are symbolic. And I think that we need to have a much more concrete and formative acts that will come forward. And I hope that if America can be a good example, actually bring people of minorities, bring women, bring those who are of different backgrounds and various gender and transgender to important roles, not just token roles, but real roles in society, and allow these sorts of things to move forward, then I hope that the United States can have the humanity and the maturity to help move that forward. I have to say it, the United States is probably farther behind than many other enlightened countries in Europe, elsewhere. As much as we think the United States is a leader, may not be the best leader in some of this. But I do hope that we can all learn from this and really make some real significant advances along the way that I'm talking about.
Thank you, Bud. Do you have a question, Esther?
Well, I have many questions, but I think that most of them will have to be answered through in writing, and we are inviting all our participants to look into our websites and to contact us through our social media. because what we are seeing right now is that many of these questions are pointing out to directions to which we should be looking at. And as Ana Maria, when you started this session, you mentioned education, and this again is coming again and again as a very important area in which we can work with to overcome the problems that we have, particularly in these times, and with a conservative backlash and the kind of problems that we are observing in the world. So I think many of these, I couldn't just choose one question because they are so overarching. But again, one also which has come up is this new concept of intersection. We have to have a new look at how we look at sexual health and sexual rights, and think about sexual rights intersecting with rights towards, in terms of race, in terms of ethnicity, in terms of age. We have to have this broad outlook, and I think this is something that we both do as ISSM as it was. We have to have this broad outlook if we are going to move forward in the area of sexual rights.
Thank you so much. And I think this was a little bit of wrap up of everything we have discussed, Esther. So I think that we have, for the sake of the time, we will start closing the session. So I would like to say thank you to the panelists for their great expertise, their presentations, and I will hand over the word to our president, who's going to finish the presentations and the sessions.
Thank you, Ana Maria. I have the pleasure. I've been seeing the chat that we had participants from all the continents, from many countries in the world. At the registration, we had registrations for more than 90 countries in the world registered. So we don't know exactly right now, but we'll come back to you for how many countries participated. Thank you for the participation. I'd like to thank Elna for the coordination, and Ana Maria and Esther for the moderating, and our outstanding speakers, Marcia, Bud, and Eusebio. Thank you very much in my personal name and ISSM name. So I'd like to thank also Pedro, Nobre, and Was to participate in this joining webinar. And Pedro, I would like to say some words.
Yes, thank you, Luiz. Again, this was a great, we are just closing this session, but I think this is a wonderful example of what we can do together. And I think it's not only, I want to congratulate everyone who was in the panel, so I won't say again all the names, but this was a very rich debate with a lot of interaction and questions. And what I also see is that a huge number of people out there sending questions and sending in the chat a number of issues that so there's a very huge willingness, I guess, to know more about these topics. And what I would say to everyone is, if you are not aware of WAS in ISSM, if you're not a member, please connect with us. You are there, so you were interested in these topics, and together we'll be stronger. And as we discussed here, these are very, very important topics: sexual rights and sexual health. And we need to be very, not only strong, but smart in trying to move the agenda forward. I just want also to say again, thank you to ISSM for this joint session. And again, I hope this is the first of many in the future. A special thanks to Luiz, the president, my colleague and friend from Brazil. And a special thank to Ana Maria Giraldo, the upcoming president of ISSM. I'm sure that we will continue to do things together, and again, I think we will be stronger together. So I think this is the way forward. I just want to add that and invite you all. Maybe Luiz also wants to say that in the name of ISSM, but we will continue to have our sessions, both WAS and ISSM. And our next online session will be actually the WAS session on sexual pleasure in times of COVID-19. And as you've seen, sexual pleasure is a very important aspect, dimension of sexual health and sexual rights. So we'll dedicate this session exactly to sexual pleasure. And this is a very important also day because the 4th of September, which will be the day of the session, is the World Sexual Health Day. So it's a global world day where we celebrate sexual health and sexual rights. So please join us on that day. And the final word, just also important to say, you had Elna as hosting this session. Elna is the president of our next World Congress, which will be the first World Congress of WAS ever in Africa. It will be in South Africa, in Cape Town, next year, hopefully September 2021. So we would love to welcome you all to Cape Town in 1 year. Thank you very much for joining us.
Okay, Pedro, and I would like also to remind you our world meeting would be in September 2020, but we decided to postpone to do it in presence next November of 2021, just to keep also our Congress in Asia. But it is the turn of Asia to host a meeting, a world meeting. So we decided to postpone. So please put in your agenda from November 15 to 17 in Yokohama, Japan. We expect having a hug and a kiss and all of you there in person. Thank you. So
Thank you very much, everybody.
Elna.
Yes, I would just like to thank you all the participants again, and thank you for everybody that worked so hard behind the scenes, and thank you for everybody that joined us. We hope to see you at the ISSM and the WAS series going forward. Take care. Bye-bye.